Welcome everybody to another episode of our Patient Voice Amplified podcast. Adam, it's good to be with you again after a little period out of the office.
Yeah, thanks, Dan. It's fun to be back, and there's always more to talk about, isn't there?
Well, who are we going to be interviewing today?
I am very excited to share the interview I had with Dr. Yaa Kumah-Crystal from Vanderbilt University. As you know, she spoke at our Digital Health Investment Symposium. I immediately knew it's someone I wanted to interview further for the podcast. So let's go right to the interview. We're excited she was willing to participate. Well, welcome to the podcast, Dr. Yaa Kumah-Crystal from Vanderbilt University. We're so happy to have you join us today.
It's my pleasure. Thank you so much for having me.
You're very welcome. Dr. Yaa, we got to meet you at a KLAS event not too long ago. You came and shared your thoughts about how to include patients and several other things. Maybe you could start by just sharing your background a little bit. How did you get where you are today?
Sure thing. So I am a pediatric endocrinologist, which means I see adorable little pediatric patients with a slew of endocrine conditions, from diabetes to thyroid to growth problems. Another hat I wear, though, is I'm a clinical director in health IT here at Vanderbilt, and I work in the Biomedical Informatics department. So I get the really cool job of trying to think through how we can leverage technology to take care of our patients, be it the little pediatric ones or our much older patients as well.
Wonderful. And what's some of the day-to-day things you're focused on these days? As we're yet again in the middle of a pandemic. I don't know what the middle means anymore, but what's on your to-do list these days?
I as well am looking forward to when COVID is something we talk about in the history books. But for now, we're just still trucking through it. So there are a lot of things that on a day-to-day basis, we're trying to think through to help support the provider and patient experience. A huge thing that came down the pike not too long ago was the 21st Century Cures Act, where patients were able to access their medical records and their notes that were written by their doctors. This was huge and very exciting for patient care and transparency, and just thinking through the logistics of how we would make sure that the notes were available, clear, legible, accessible to patients upon their request, whether we would have to set reminders or alerts, and how to educate patients on how to access that information. Another thing that really kind of exploded during COVID was telehealth. And with telehealth, what was pretty remarkable, I don't know if you guys got snow wherever you were, but this weekend we got a nice little dusting of snow, and the previous week as well. And whereas in the olden days, clinics would have to be canceled and we'd have to reshuffle patients to the next week and figure out where to set people, we hit our stride. We were just like, well, let's just convert these patients to telehealth and make sure everybody gets seen and everybody gets the care they need. So things along those lines, just practical clinical operational things, making sure that people are getting the care they need so they can go about their day and have a great life. And then I also get to work some cool kind of looking out to the future blue skies kinds of projects, like, hey, how can we leverage some emerging technologies like the Amazon Echo so patients can ask information about their health and find out things about their medications and communicate with their doctors? How can we use the same tools to help providers find information about their patients by saying, like, hey, tell them about the cholesterol, and have that be part of the conversation with the patient, the provider, and the computer all in the same room?
But there are several, maybe we call it silver linings of a pandemic, as strange as that sounds to say.
Okay.
And we've heard similar things on telehealth. I appreciate you sharing that very recent example, in addition to a pandemic with the weather-related delays, et cetera. What do you think is different now compared to maybe the start or early months of COVID, whether it's related to telehealth or anything else? Have you seen an evolution of different things related to patient care?
Absolutely. I think people have just become so much more comfortable and used to the idea of emerging technologies and change. We all had to change what we were doing, how we were thinking, how we were adapting, just on the fly every single day. And the fact that change is actually part of the norm now is pretty interesting. And as you said, kind of a silver lining, because now as we're able to try more new things and be more agile with our approach to patient care, I think it's allowing us to do more things than we were able to consider before, where there were more longer processes to go through everything. And we're also able to engage patients more in the thought process of, well, how does this technology work for you? Give us your feedback early on so we can continue to maneuver things together and build this specifically for your use cases. So with our patient portal, for example, thinking through how to appropriately notify patients when it's time for their visits, how to send them their lab information, how to coordinate getting labs at their pediatrician's office if they're not able to come to the clinic, and using the technology in creative ways. And I often talk to my patients after the fact saying, well, how was that for you? How easy was it to print out the lab requisition? How can we make this faster and more efficient? They have lots of great ideas that I'm able to take back to the health IT group and say, hey, have we considered this? This was directly from patient suggestions. And people are quick to say, let's try that. We're trying new things now. We're being more flexible. Let's see how we can improve the experience.
Well, that's fantastic. One thing my colleague Dan Check and I have learned is that the patient's preferences are often different than what the provider needs and what the vendor of healthcare IT may be developing. So there has to be those bridges there. And I love that example you just shared. You gave a wonderful TED Talk about how computers can rehumanize the patient experience. Since you've given that talk, how are you seeing that in your everyday practice and teachings? And now that we've had the pandemic since that talk, I'm curious how you perceive that concept today.
I think one of the most interesting things about technology and the pandemic is how it allowed us to continue to stay connected. If this had occurred, I don't know, maybe 20, 30 years ago, or we had very reliable internet, our ability to have these virtual meetings, have these conferences, meet with our patients via telehealth, or even just to, talk to our parents to check in on them, just wouldn't have been the same. And technology can serve different purposes. It's a tool, and depending on how you use it, you can get great benefits, like being able to connect. Or on the other hand, it can maybe be isolating if that's the place you're going to try to disconnect. So it's really about understanding how we can really leverage it to meet what the patient's needs are for the care delivery. So for example, for telehealth, one of the things that we have to do as providers when we're seeing our patients, we have to document, we have to get the notes about what they're saying so we can go back and make sure that we're writing the right prescriptions and that we're cataloging all the important things that they're saying. But if I'm having a telehealth conversation with you, the last thing you want me to do is be looking down at my keyboard and typing and saying like, oh, just a minute. And that takes so much away from your experience. So it's really exciting that there are new emerging tools that exist even today that we're going live with next month that allow the conversation that we're having to be automatically transcribed. So I'm not worried about writing a note so I can get down everything that you're saying. You're talking to me and I'm talking to you, and I'm listening word to word about what your concerns are. I'm following your facial expressions and your pauses to really help identify what we need to do to make sure you're in the state of health you need to be. And the kind of administrative task of getting the note done just gets done because the computer is serving a purpose. The computer is doing what a computer does well, and it's understanding the words, it's transcribing, and at the end of the day, it can come up with a great note that I have for myself that you as a patient can read also, because now we have open notes for patient, and we're able to really have a humanizing connection without the computer being like this distraction.
That's a great example. What other processes are in place, maybe at your organization, to include the patient, to listen to them? It certainly has to be a cultural thing, but are there specific steps in place that you could talk about of, hey, here's how we're trying to listen to the patient more, either more often or more deeply, or whatever way you may be doing that?
Absolutely. Well, we have a lot of focus groups. We have patient engagement groups. And what's interesting about the patient engagement groups, a lot of our patients end up being staff also. But everybody at some point is a patient, even like the second you're born. Assuming you're born in the hospital, you are a patient. And unfortunately, people have challenges with their own health journeys. People get sick, minor things, and more severe things. And it's surprising what people are able to go through. And it's also really humbling as a physician what colleagues and people I work with share with me about their health to try to get some extra advice or guidance. So just have deeper understanding of the process that people on an everyday basis have to go through with regards to managing their health. So having that level of empathy and understanding that people are patients too, and then people outside of Vanderbilt, making sure that we're engaging with them, getting feedback with regular meetings. Every time we have new features that are in our patient portal, we vet it with them. We say, well, what do you think about this? And how should we configure this? Because what's neat about the way we're implementing things, we're usually able to customize things and configure things, but we need to make sure it makes sense. And us on the health IT side, like while we are patients too, sometimes we're in the weeds, so we don't understand stuff as well. So we make sure that we have a good quorum of folks that are outside of the workflows that we use normally to give us their feedback. But it's also really important just to make sure you're engaging family members, young and old, and people that wouldn't necessarily always be represented, that speak different languages and of different cultures, so they can provide feedback about how to make the experience just holistic for everybody.
So there's probably a lot of our listeners trying to consider what are other ways they could involve the patient more. In addition to what you've already said, do you have any advice you'd give either other providers? And then second part, what about vendors? What would you tell them that develop this important technology, how they can include the patient?
Oh gosh, I think one of the neatest things the vendors could do is provide ways for the patients to give feedback, like at the time that they're using the tools, like when they're either sending a message back or checking on their labs, to kind of give immediate feedback, kind of thumbs up, thumbs down buttons, so that they can understand how people are using it, and to analyze the data to see what tools are used frequently, what tools are used infrequently, and to hold these sessions with patients as well. We meet with our developers to get feedback about what's working for us in our provider workflows, and we get feedback from the patients that we share with the developers. It'd be great for the industry as well to meet with the patients and to understand how they're using the tools as well. And also to kind of have a clear roadmap and vision of what it is they want to accomplish, to minimize just the amount of friction and the amount of work that goes into finding your information in the chart. Using more clear things like natural language processing, where you're not looking for a specific button to find. You just say, like, I want my labs. You can type in, I want to see my labs, and you have your intention. You know what you want to do, and then that information presents itself to you without you having to figure out what the layout is. So I think just every step of the way, making the system more responsive and dynamic, maybe allowing patients to kind of beta test things, and doing opportunities to try new layouts and getting feedback about those, and having kind of agile development processes, so that along the way they can see what works and what doesn't. There's so many techniques that we could employ to do more of, to really make the experience better for patients.
As you look towards the future, what's something you'd love to see industry-wide, maybe a change that could happen to make our care and our technology more patient-centric? Anything come to mind?
So industry-wise, I think I would love for patients to be able to get a better example of how their health aligns with other folks, like their peer groups. So on a provider side, we have a general idea of where a patient's supposed to be with regards to like their blood pressure and all the other parameters. I think it'd be useful for patients to be able to say, well, how am I doing? This is what my specific goals are, because I have kind of a very custom care and a very tailored care based on who I am as a person. But how does my care look with regards to other people that look like me? And to get a better idea of what else is available to them with regards to treatment regimens, and to have an idea of how to easily get access to patient information. I get patients emailing me questions about, well, what are the common side effects of this medication? And then I'll be able to, Google stuff, share stuff with them. I want patients to feel empowered to be able to get that information right from the process of us having a conversation. So say I had a clinic visit with a patient and I typed in my note, like, I think they should be trying this medication. And in the course of that, we would have this conversation about the common side effects. It'd be great if that could be captured somewhere so they could go back and watch that to review that clip. But also, like, in the notes, if they just clicked on that, that could like pull from some database where it could easily explain to them what the common side effects are. Oh, and by the way, maybe we could integrate that with some kind of like voice technology tool where they don't even have to interface with a computer. They could just ask, what are the common side effects of this medication that I'm taking? And it would understand that context and report back to them that information. So just making everything just a lot more integrated and seamless. The biggest thing I think that I know a lot of smart people are working about is just health information exchange. It's remarkable how I see a patient that goes to a clinic maybe like 5 miles down the street, and I'm completely blind to what their information is in that medical record, what labs they had, what radiology they had. We have to repeat some labs sometimes just because we just don't have access to that. So an easy way to just be able to transport information between clinics and for the patient's sakes, because I know that's so frustrating for them as well.
That is key and comes up often in our research, and something we hope to understand more. And we've got some efforts we're partnering with others on. How do you get that data easily shared? And love that example. And when you bring up empowering patients, that aligns very nicely with some of our research, where we've started to interview patients and ask, hey, what kind of things do you want to see? And the concept of better empowerment absolutely comes up. So I appreciate you sharing that. Well, Dr. Yaa, we know you're doing a lot of important things, and to give us even a couple minutes is generous. Would love to hear any parting thoughts, things you're doing that are working, other things you hope to see in the near future. What else would you share with our listeners today?
I think that we're heading in the right direction with regards to engaging patients more. I think the Cures Act and Open Notes is great steps in the right direction. I think the more we're able to help patients feel comfortable sharing more of their information and having that be more of their the decision points that we're able to use to deliver their care, the more seamless care could be. So I think, most people are now used to wearing, Apple Watches and Fitbits, and figuring out really unique ways to integrate that information into the patient's medical record, so we can have predictions about what their outcomes will be based on their level of activity. We can help them with things such as like weight management. Everybody has a New Year's resolution this year, and if I could partner with the patient and have access to that information, we could give recommendations about things they could do to get more steps in the day and things like that. So just really partnering with patients, leveraging tools they're already using to help them guide their care in the direction they want to take it, I think could be a really neat thing.
Another great example. Thank you for that. Well, Dr. Yaa, thank you so much. We appreciate what you're doing. Thank you for being willing to share your time and your insights. We're cheering you on and hope that we can be available to support you and your team any way we can. But that was wonderful. I really appreciate your insights today.
Well, I'm so pleased to have been able to participate in this. I love what you guys are doing. I love that the patient is first always, because at the end of the day, everybody's on their own individual and unique health journey, and we're here to support them. And just keeping in mind that at the end of the day, we're all patients, and our loved ones are patients, I think helps to keep us in focus about what's really important.
Agreed. Thanks again. That was awesome. We appreciate your time, and we'll talk soon.
Have a wonderful day.
Thank you.
Well, Adam, great interview with Dr. Yaa. Tell me one or two things that stood out to you of the things that she mentioned.
Yeah, I've really appreciated her time, and I liked how she talked about the benchmarking groups that they have. Just those efforts are things we all need to learn from and share with each other. I think that's really key. Really having a formal process to listen to patients and trying to include them as much as possible. She talked a little bit about empowering patients and making sure that they have what they need as well. So that was two things that jumped out to me. How about you? You've heard the interview now, and what jumped out for you?
Yeah, maybe two things I would share. One, I really liked her infusion of the regulatory pressures and the changing environment and what that's done to their patient engagement strategy. Particularly that she talked about the 21st Century Cures Act and what that's done with the open information for patients. They went through a period of standardizing the notes and making them legible, understandable for the patient. I just think that's a great way to think through a challenge, something you have to change from a regulatory perspective, and think through how is the patient going to take this data and how will they interpret it. The other thing, to piggyback on your point about the benchmarking and the different perspectives of patient engagement, Dr. Yaa didn't share this in the interview today, but in that symposium that she spoke at a few months ago, she shared the story of the blind man and the elephant, or the blind men and the elephant, yes. And how they come, there's this new creature that they're introduced to, and they all touch a different part of the elephant. And one talks about the trunk of the elephant and how it's like a big thick snake, and another talks about the legs and the tail, and they all have different perspectives, and they describe the elephant in different ways. It's just like that with patient engagement and really focusing on the patient. It's not one perspective that we're looking for here. You really need to understand the patient from a lot of different points of view, a lot of different roles, types of patients, to really be able to deliver care in the best way possible.
I love that analogy. I'm glad you brought that up. And it feels like within the same organization, you have different blind men trying to understand what it is. And with the many terms out there, the many definitions that we run into in our research, digital front door, a perfect example. We've talked about that on the podcast, how there's very little agreement what it means. And our advice to providers is to have a clear strategy and define it well, get agreement, even with vendors that we work with, to try to guide them and share a vision and lead them along. So I love that analogy. Thanks for bringing that up.
You're welcome.
Well, Dan, I know that we're constantly trying to listen to the market and bring to light to the podcast things that we hear recently. Anything come up for you that you want to share with our listeners today?
Yeah, I was looking at a few quotes that came across our desk recently that our peers have collected. These are two quotes I want to share specific to the patient portal. And I won't share the vendor names, I'll share the anonymized quotes and a thought about them. So quote number one, our patient portal is very easy for the patient. Sometimes it is too technical for older generations, but younger generations can go into the system and get everything they need. The product is good, and it has a lot of features for patients to use. And here's quote number two. As an organization, we have a lot of end users that are having a very hard time adapting to or using the product. Our patients have had a hard time being able to understand some of the features. The patients feel like they receive too many notifications, emails, or calls. We don't have a lot of people who are able to understand the nuances behind our patient portal. It is very different than other products that patients are using. So the reason I bring up these two quotes, they talk about some positive and negative aspects of the patient portal. But at the end of the day, many of our podcast episodes have talked about some of the challenges and the nuances of delivering technology in an impactful way to the patients. And I just think this is such a complex problem we're trying to solve as an industry. We need to give ourselves a little bit of credit and understand that to the story of the blind man and the elephant, we're looking at this from different perspectives, and younger patients and older patients have different experiences, and some want a lot of technology touch points, and some feel too many text notifications rubs them the wrong way. Every patient's a little bit different. That's where preferences come into play, and you really have to understand almost each unique patient to understand how to engage them in the best way.
Boy, you're totally right. As you know, we're deep into our analysis of the patient voice report, where we've interviewed more than 13,000 patients, and that's coming up in every question. Different preferences based on age, race and ethnicity, insurance type, even the type of care they're receiving or how often they interact with the clinician. They all have different preferences, right? And So I'll add this based on your comment there. We're seeing in portal usage, younger patients are using it less frequently in general. And this sample size is based on some ambulatory patients and such. And it will vary based on all of those factors. So I think you're exactly right, Dan. I'll add one more piece that I'm learning in our research. A lot of patients that we interviewed, we asked all of them about their portal usage in general. How often are you touching it? Right. And 24% told us they never ever use it. And so what that tells me is, even with these technologies that are evolving and there's new capabilities that they can tap into, we have to solve issues for different patients, to your point. Some aren't even touching it. And how can we make sure that they're engaging more in their care? Because we know this isn't going away. We know organizations want better experience. They want to reduce costs. All of these reasons why we are doing so much research in this area. So really appreciate you sharing that, and we're excited to get that report out. It's coming soon. Yeah. So I'm sure we'll be talking more about it.
Well, Adam, I know one of the things that we appreciate from you every episode is a quote to round out the story. So tell me, who are we hearing from today?
Okay, so I have a quote about perceptions, and this is from someone named Apurva Kala. Your perception may not be my reality. I like that quote because it reminds us the patients have different realities, and we need to understand that and pay attention to that and include that in these type of discussions. It's not just the clinical relationship, but with technology as it is, there's many different preferences. And I love the spirit of these conversations where people are trying to listen, trying to engage and connect and understand more. And I think that's at the heart of why we're doing this. So there you go. Your perception may not be my reality.
Great. Well, thanks, Adam. We'd like to thank again Dr. Yaa for sharing her perspective with us today. And
I want to thank Jeff Peterson, our colleague and classmate that produces and edits and organizes all of this. So thanks to Jeff and also our other colleagues at KLAS that help us gather this data and try to improve healthcare. So thanks for joining, Dan. Always a pleasure, and we'll see you next time on the podcast.